this is your host, Julia Nepini. I am a clinical and forensic social worker who owns a counseling practice and a consulting business. In this show, we discuss the challenges of being successful in business while maintaining your integrity and staying true to yourself. Join me while I interview other professionals and share insights from life and experience. Let's talk about RingRx, our latest sponsor. RingRx is a high-quality, HIPAA-compliant telephone, text, and fax communications platform. They provide seamless, cost-effective communications for behavioral therapists, medical practices, hospitals, and other healthcare providers. RingRx is designed for modern healthcare environments. They offer customizable features like a phone app, automated patient outreach, voicemail, after-hours call routing, and top-quality desk phones. Try RingRx for free today at ringrx.com. And if you sign up using the code CLIMB, you'll get 15% off your monthly bill forever. Conditions apply. Hello and welcome to another episode of the Compassionate Climb podcast. I am here for a solo episode today. Our focus is going to be on answering the question that I get asked very frequently in my role as a consultant and also as a group practice owner. Do clinicians still want to join group practices? So first of all, where is this question coming from and why am I getting asked so frequently? In large part, I think it has a lot to do with us being post-pandemic. At that time, a lot of clinicians, all of us, not just clinicians, but talking specifically about those of us in the mental health profession, really started reconsidering work-life balance and how we were doing the work itself, having the option to provide virtual therapy or therapy over the phone, increasing accessibility, decreasing the cost and the expenses associated with starting a business, and the ease with which to do so really transformed private practice. Then when you added in these platforms like Alma or Headway that take the aspects of private practice that can be incredibly daunting for some of us that have never had any training specifically in business. We're not familiar with insurance companies, credentialing, billing. And you now have these companies that are able to take care of all of that for you, get you credentialed, expedite that process, reimburse at a higher rate very oftentimes than if you were to credential yourself. You don't have to worry about collecting payments or submitting claims or following up when there's an issue. That again increased the likelihood that somebody would start their own practice, plus a host of many other things. So when I am working particularly with solo practice owners that are considering expanding to group, many of them have more referrals than they know what to do with. They're feeling very isolated and lonely in private practice. They want to work in community. They want to help more people. Some would like to see less clients and maybe do some other things. Some have interest in being in a managerial or a leadership role. So whatever the reason, before they put in the work that they know is going to be associated and take that risk and that leap of faith, they want to know, what is the likelihood that people are going to want to join my practice? Do most people just prefer to join their own? Are they going to actually want to join mine when they have the option of community mental health or working in somebody else's group practice? So I am here to tell you that in my experience, there are a plethora of clinicians that would much prefer to work within a group practice than work solo. And I'm going to highlight some of those things that they're considering that you can really highlight in your expansion journey that will entice and intrigue those clinicians that are looking for these things. So first and foremost, it's the collaborative learning environment. So for those of us that are lifelong learners, in order for us to do this work, we've already obtained a master's degree. We have to pursue independent licensure and pass an exam and get supervision. And so the hope is that we continue that education throughout our entire career, that we're learning about different modalities. We may specialize or develop a niche. We obviously have to maintain our continuing education. We are hopefully continually getting supervision, but consulting on cases and learning from other people in the field. And so for many clinicians, they want to enhance their clinical skills by sharing knowledge, expertise, and best practices. For those of you that are listening that are in the mental health profession, you all know that the majority of the cases we deal with fall in the gray. They are not black and white. Now, not to say that there aren't still laws that we follow, ethics, and there's our clinical judgment. But for the most part, there are going to be nuances and specifics to each case. And it's extremely beneficial to have trusted colleagues that you can go to when you are questioning what the right thing to do is, and learn from their similar experiences. If they haven't had a similar experience, having them consider what they would do. Maybe there's something that you overlooked or you didn't consider. So that is definitely something that is drawing clinicians into the group practice model as opposed to starting their own practice and just working solo. I would also say reduced administrative tasks. So for those of us that truly enjoy the clinical work and interacting with clients and hearing their stories and utilizing therapeutic techniques, it is very rare to find someone that also enjoys everything that has to do with running a business. So that would include things like all of the client contact. It would be sending out intake paperwork and following up to make sure that it's complete. It would be returning phone calls and responding to emails. It would be verifying insurance benefits, collecting payments. It could be submitting claims. It could also be the creation of your website or a therapy directory. All of the things that are required in order for our business to be successful, for things to run smoothly, to make sure that clients are finding us and that they are getting scheduled and seen and we're able to do our best work with them. So many clinicians would much rather focus on client care and the therapy itself than focusing on scheduling and billing and all that goes into making sure your caseload is full and the right clients are finding you. When you work in a group practice, very oftentimes the practice owner may be responsible for those tasks initially, and then very quickly, especially if you're growing into a larger practice, they're going to find somebody to do that. It's going to be either an administrative assistant or a virtual assistant. They may hire a biller if you're an insurance-based practice. And sharing that cost among several people is much more cost effective than you just paying someone on your own. And it also can be extremely efficient because you are much more likely to be able to afford somebody that is skilled in that role and is able to really develop systems and processes that work for that group. Support network. So in addition to the collaboration, it's that ongoing support of, if you are an in-person practice, knowing that you have a therapist down the hall that you can check in with in between sessions if you want to run something by them, knowing that you have opportunities to come together as a team, knowing that you can not only consult on cases, but that sense of community and that mutual appreciation, respect, shared responsibility. How about care coordination? We're a generalist practice. We treat the whole family. We work with all ages. And to know that you as the clinician are not responsible for helping every member of the family unit, that you can focus on your work with mom while another clinician who has specific training and enjoys working with children can work with your client's child, and that you may have somebody else that's working with their partner, and maybe somebody else that's working with them as a couple. So you don't have to carry the weight of their world on your shoulders. You can focus on the work that you're doing, work in collaboration, trust that good work is being done, and that these other aspects of the dynamic are being worked on. And being part of a group and the opportunity to consult not only on just the caseload that you're seeing, but complex cases, ethical issues that arise. For many clinicians, it's very intimidating to hang your shingle and you are out completely on your own. And if you want to consult with someone, you have to seek that person out on your own. You have to pay somebody to supervise you, when a group practice is an already established team. Financial stability. So one of the most intimidating aspects of starting my own practice was leaving the hospital that I was working at. I call it the golden handcuffs, where it was consistent income. I knew what my paycheck was going to look like every week. The hourly rate was competitive. I had all the benefits. And so leaving that to do my own thing, knowing that I was going to be responsible for setting aside money for any time that I wanted to take off. If I needed a sick day, I would be responsible for my own medical insurance and dental insurance. And if I wanted to save for retirement or get a disability policy or a life insurance policy, all of that fell on me. So when you join a group, and especially a well-established group that hires employees and is able to offer benefits and really incentivizes their clinicians and acknowledges them for the work that they're doing, this enables the clinician to avoid startup costs. The overhead costs of the business are shared among the team, and everybody benefits from that shared client base and referral network. How nice to not have to stress about your caseload being full, whether or not you're going to be assigned the right clients. Are you going to have gaps in your schedule? You have people that are working on that on your behalf. I would also say the stable income and benefits. So not only financial stability in terms of some sort of consistency, whether you are paid a flat fee and you're paid regardless of whether or not the client comes to session, or whether or not insurance pays for that session, or even if you're paid, let's say, a percentage and you get paid when the practice gets paid, they have some level of responsibility to advocate for you, contact the insurance company, and do everything possible to make sure that those funds come in and you're ultimately paid. But the benefit piece. So group practices typically pay for sessions regardless of client or insurance reimbursement, and they have the ability to offer paid time off, potentially paid holidays, other benefits like I mentioned, the medical, dental, vision insurance that is a lot of times much more cost effective when it's a group practice that's offering it. And then they can offer things like CE reimbursement or disability insurance, like I mentioned, retirement benefits, and maybe even an employer contribution. So like I had said, those are all things that would be your responsibility that are now potentially up to your group practice. And then continuing education opportunities. So group practices often will provide reimbursement for CEs, and we're all required to preserve our licenses and make sure that we are up to date with our trainings. But when you get to a practice the size of mine, we have a training budget, and that has allowed us to get feedback from the team. What are the modalities that they want to get trained in? What are things that they're interested in learning? Working together to try to find those ideal people to provide those trainings, and also accessing continuing education courses. So we now have all of the trainings that we've purchased virtually for the practice that everybody has access to log into. So at any time, they can complete those trainings, and the practice owner is the one responsible for paying that cost. So those are just a few suggestions. What I would say is that there will always be people that would much prefer to work on their own, and everybody has different preferences in terms of the level of oversight and what the group practice is going to be offering. But in most cases, I would say that working in a group practice is likely going to be a stop on most people's journey, and I would recommend that it should be. before going out on your own, because you have the ability to learn so much about the business side of things, to develop your niche or your specialty, and to really utilize all the group practice is offering before you go out on your own, if that is your ultimate goal. And then there will always be people that will forever work within community and remain in a group practice for all of those reasons that I mentioned and then some. So I hope this was helpful. Thank you all for listening, and stay tuned. My goal is to kind of sprinkle in these solo episodes in combination with the interviews to really focus on a lot of the themes that are coming up for me in my consulting work and sharing a lot of what I have learned in my own journey expanding from a solo to a group practice. Till next time. If you like what you're hearing, please rate and review. This will help others find us and benefit as well. The Compassionate Climb podcast represents the opinions of Julia Nepini and her guests. The information provided is intended for educational purposes only and should not be taken as legal advice. If that is what you are seeking, please consult an attorney.